off. I don't want to, we only have a half hour, so.
That works.
All right, I'll kick it off. Hi, everyone. Thank you for joining us today for our VetLink Kiosk Webinar. I'm Kelly Elmstrom, Vice President of Marketing at BTSSS. So back in 2009, we partnered with the VA to launch the largest self-service initiative ever, say that 3 times fast, VetLink, where we implemented over 6,000 kiosks. And since then, we've worked alongside the VA to really help them reduce operational costs, streamline patient intake and registration, and really just enhance the care and customer support experience for our veterans across the country. Just this year, we processed over 1.2 million BTSSS claims, over 38 sites via the VetLink kiosks. Today I have with me Mark Hudson, who's our Vice President of Sales, as well as George Phillips, who is our, I want to get your title right, George, Premier Services Lead for Government Services. And he has worked with VetLink in the VA for over 15 years. So I'm going to hand it over to George. And also just a little housekeeping, if you have questions as we go along, please feel free to speak up, chime in, or type them in the chat or the Q&A. Okay, over to you, George.
Thank you, Kelly. Yes, I'm George Phillips. I have worked on the VetLink project for 15 years. I started as we deployed our first kiosk to our pilot sites during our national deployment, and that was in 2010, 2011. And since that time, I've seen the system grow in size and capability over the years. So what I want to show you during this demo is going to be some of our more popular workflows. We're going to review the check-in workflow, the BTSSS workflow, the ROI workflow, insurance card scanning, wayfinding, and contact information updates. These are going to be videos that will show those capabilities, and we can certainly stop along the way and answer any questions that you might have and that you may put in the chat. So let's get started. We're going to start with the check-in workflow. This is one of the popular workflows that the facilities use. The BTSSS workflow, which I know many of you are probably very interested in, we'll talk about next and go over that in detail. So let me get started here. So as with all of our workflows, we have a kiosk and we have a kiosk sign-in. The veterans can use their VIC card, scan the barcode, or swipe it, or enter in their social security number, followed by their date of birth to confirm their information that we're pulling from Vista. So you're seeing our test patient entering their date of birth. It's going to finally ask them to confirm that that is them. And we'll start the workflow. So all of these modules are configurable. In this instance, we're updating an address. As soon as this address is updated, we can configure the system to either write it directly to Vista or to have it reviewed by a staff member at the end of the day. We can update insurance on the kiosk. We can review next of kin as part of the demographic updates. And again, it gets written to Vista automatically or after a review. We can ask various questions like, how did you arrive today? If you have any legal or on-the-job injuries. And then we get to the check-in portion. So that patient has now checked in. We can choose to view directions to the appointment by selecting the clinic, pressing continue. and they will receive a receipt as well as the printed directions on the screen. They can view their future appointments, and that completes this workflow. We also have our admin tool, which your staff would utilize, as well as displays that can be placed either in the waiting room or behind a secured door so that you can display patient data. We can update the veterans' locations based on what room the patient is going to be seen in, and those locations and statuses will update real time on the display on the right. So this is a way in which we can interact with the veterans' patients using intelligent queuing displays, either displaying their name or a assigned ticket number to protect the patient's privacy. So again, the VetLink admin tool is used to help facilitate veterans through the hospital. And then once they're done with their appointment, the veteran's name will drop off at the patient display, and you'll know that that patient has been through the check-in workflow for your clinic area. So I'm going to stop here real quickly. Are there any questions about that check-in workflow? Okay, just let us know if you do have any questions. Next, I'm going to go to the BTSSS workflow. And again, this workflow is very popular. If you recall using the Benny Travel workflow or have seen the Benny Travel workflow on kiosk previously, it's essentially the exact same workflow, except with our latest upgrades, we're now pushing this data directly to the BTSSS system with great success. 99.5% of the claims submitted via the kiosk get entered into the BTSSS system, which eliminates any need for your staff to complete those paper claims manually. So again, we're going to see the veterans signing in at the kiosk. They're going to self-certify information on the kiosk, agree to the agreement notice. If they have multiple appointments, they'll have to select one and press continue. And lastly, they can sign the digital form with their finger. And that's it. Their claim is now in the BTSSS system. We also provide, just like the check-in workflow, a admin tool where you can view those submitted claims. You can view the claims. You can see the claim number that was returned from the BTSSS system. And as I mentioned, not every claim is automatically accepted. About 0.5% do get returned to us for review. And those claims go into our BTSSS claims queue. And from there, you can review the claim. You can download the digital form and correct the claim within the BTSSS system. But again, it's typically a light lift. Less than 0.5% end up in this queue. We also provide reporting to go along with all of these submitted claims. Our pilot site that has deployed BTSSS, they've had it the longest since about the beginning of 2024. They do about 600 claims a day. This is the Charleston facility. And it's really saved their staff members a lot of time because each of those submitted claims saves about 8 minutes of time as opposed to using those paper claims. So I know BTSSS is a popular topic. Are there any questions about BTSSS? Okay. Again, just let me know. Next, we're going to look at the ROI workflow. The ROI workflow is very similar to the BTSSS workflow in that you're filling out a digital form on the kiosk. This is helpful for a lot of ROI areas where they no longer have staff. They have somebody checking for these digital forms on a daily basis, and they can complete them in their free time. So this has been a big help for staff members with reduced staffing levels. So as always, you're going to get sick of seeing these, but the veterans are signing in. They always sign in either with their VIC card or their social security number. They'll confirm their information by entering their date of birth. And then they will be asked to select the way in which they want to receive their form or their health information. They can select their start dates of treatment and their end dates of treatment for the release of information.
Hey, George, we did have a question come in. When the veteran submits the mileage claim and it goes into BTSSS, does it go into manual review or is it auto paid out?
It depends on the claim. So if you're familiar with the PCI tool and how the PCI tool submits claims using the API, we're using the same API as the PCI tool. So reasons why it would go into manual review are if the veteran is the distance between their home and the hospital is too great. Typically that requires those claims to be reviewed in the manual review queue. Another reason why we see some of those go into manual review are I just lost my train of thought. If the appointment hasn't been checked out at the time of the activity, but those claims are in the BTSSS system, and typically with a push of the button they can be cleared through. Most of the other claims do get auto adjudicated, so the answer is a combination of manual review and auto payout or auto adjudication. Okay. Any other questions about that BTSSS workflow?
I think it's good.
Okay.
Thanks, George.
You're welcome. Back to the ROI workflow. The veteran is able to update their address information because a lot of these medical requests get mailed out to the veteran. So we want to make sure they have the correct address information on record. Moving on, they can select various information requested, and this will get generated on the digital form, which we'll see at the end of the video. So again, the veteran signs with their finger digitally. And their ROI request is now submitted. And this form, this digital form, which you'll see in a moment, can either be printed to a network printer behind a secured desk, or they can just use this digital form, complete the claim, and file it in an electronic copy in a secure folder somewhere. So here's an example of the form as it has been submitted, and you can see how they requested their delivery, the dates of treatment, and the various items that they are receiving information for. Okay. Are there any questions about the ROI workflow? And again, we'll have question time at the end of the webinar. So if there are any additional questions that you're not thinking of, we can get to those. I'm going to go to our insurance card scanning workflow. The thing you need to understand about this workflow is we capture the insurance cards at the kiosk. There's a camera on the kiosk where the veterans can capture their insurance, take a picture of the insurance cards. We can turn this workflow on within or outside of the primary check-in workflow. I'm demonstrating it as a peripheral workflow rather than within the check-in workflow. So again, the veteran's going to capture their insurance card with an image, and the staff members will then update the ICD with that information. Okay, so as always, the veteran's going to sign into their workflow using their VIC card or their social security number. They'll confirm their date of birth. Ask them if they have additional insurance, and in this case, the veteran's going to say yes. It'll ask them if they have their insurance card, and then they'll have the opportunity to scan their card. They'll be asked to flip the card to the back, take another picture, and confirm who the subscriber is, and complete the workflow. So we've now scanned the veteran's card. Again, we're going to show you in the admin tool what that looks like. So we have our veteran, and you can see the notification, insurance to be added. Now, I know this isn't an insurance card, but they can take this insurance card image and they can transcribe the group number and policy number into the ICB, as well as uploading the file. We also find the memo field that you're seeing updated here helpful, so that your staff knows that the work has been done. So this is a memo that's viewable to all other staff members using the VetLink application. Okay, any questions about insurance card scanning? Okay. Next, we're going to look at wayfinding, and I briefly showed this within the check-in workflow. This is going to be the same process, only as a peripheral workflow. So the veteran, again, is going to authenticate at the kiosk. And if they need to know where to go, the kiosk can tell them, provide them a simple printout on a receipt with word directions from the kiosk to the clinic. So the veteran's going to select the appointment they want directions to, press continue. They'll see those directions on the screen as well as on that receipt that's printed on the kiosk. Again, this can be done within the check-in process, within the check-in workflow. Any questions about wayfinding? Okay. The next workflow we're going to show is the contact updates, which you have seen within the check-in workflow, but I want to go over it one more time. And again, veterans can do this during the check-in process, or if they're in the facility for a walk-in visit or for any other reason, they can authenticate at the kiosk, make sure their address is up to date so that they don't miss any important mailings, prescriptions, things like that. So again, as with all the workflows, they're going to sign in. They'll use their date of birth to confirm it's them. And again, we can turn on various modules. We can just update contact information, or we can just update next of kin information. It's really up to the facility. It's completely configurable. And again, as with the other workflow, this information will get updated to Vista automatically, or if you choose to perform a review of those updates, we can set it to do that as well. Okay, the veterans just updated their insurance and their next of kin information. Okay, any questions about the update information workflow? Okay. So those are the some of the workflows that we manage in the system. Those are what I would call the pre-configured or canned workflows that are very popular. We also build out all sorts of walk-in workflows. You'll see some examples in the next slides that show you what some facilities are using for their walk-in workflows. So as part of the operations and maintenance for these systems, we'll provide you with some performance reports so that we can help you facilitate veterans through the kiosks more efficiently. This is an example of our Charleston facilities reports from the month of June 2025. They've performed in the month of June 36,600 kiosk check-ins. So those are 36,600 interactions where the veteran walked up to the kiosk and they checked themselves in. They may have updated their information at that time, updated insurance, but those are 36,000 successful submissions. The yellow color are the Benny Travel submissions. They did about 10,000 in the month of June. They average between 12,000 and 10,000 per month, depending on the number of days within the month. So that's another popular workflow in the Charleston location. The other colors are the future appointments workflow, which you definitely saw an example of. Update information workflow, release of information workflow. So those are minor utilization there for these devices, but they are counted towards their total number of 45 to 50,000 interactions in the month for Charleston. And those are just for scheduled appointments. We'll talk about walk-ins here in a moment. We provide some data to help them troubleshoot their problem areas. We look at these reports for specific type of manual assistance reasons. So for example, Mod 4 in Charleston, we're just bringing that area up and it has pretty low utilization. It has some unassisted check-ins that aren't occurring as we expect them to, and we take a look at the manual assistance reasons to help them figure out how we can get them into the green, get them working as efficiently as possible. So it's an ongoing process that we work with your facility and yourselves to get the most out of the kiosk, get the biggest return of investment for these devices. I mentioned walk-in queuing. So this is an example of Charleston's walk-in queuing numbers. They do about 9,000 walk-ins a month, and those are mostly labs, optical shops. You can see on the right the key X-rays, eligibility and enrollment questions, and these are used to help the veteran sign in so that the staff members know who's there, who they need to see, and what they're there for. So we'll help you build these out for your facilities for any one of these reasons or reasons that we may not be aware of. We're completely flexible in the capabilities of these walk-in workflows. And last but not least, for these reports, and we provide more reports than this, but this is kind of a high level of what we provide. We provide a BTSSS report that can show the number of claims that have occurred, and this is since the beginning of 2024. So in Charleston, they've done 256,000 Benny travel claims. And if you remember, that's 8 minutes saved per claim as opposed to the paper submissions. So that's something on the order of, I think I calculated it out to be about 34,000 hours saved of staff time. And if you're familiar with the BTSSS system, you might agree that the kiosk method of submission is a little easier than the website method of submission, and the paper forms. Probably get through that kiosk workflow faster than you can fill out the paper form. But again, we work with folks to fine tune these, make sure we get the most out of the kiosk, the biggest return for your investment on the devices that you've purchased. And that is the last report I wanted to show you. So at this point, I think if there are any questions, I'm more than happy to answer them.
Thanks, George. That was great. This slide just really speaks from some quotes from our customers that are super happy with the VetLink kiosks. But yes, if anyone has any questions, now is the time. And we did see in the meeting chat, Alexander was requesting some information, so we'll follow up with you right after this meeting. We will do. Thank you. Okay. Thanks, everyone. We hope you enjoyed the session, and we will be sending it out afterwards.